Hi everybody, this is Dr. Norma Esparza. I wanted to say hello to each and every one of my wellness patients that I haven't been able to see for a long time. As you can see, I am not an anchor woman, but I'm going to make this short and sweet. Last Thursday, Governor Abbott has allowed our licensing board to allow us to continue seeing or to go ahead and see patients that are wellness patients. Up until then, we could only see acute patients and people that were in a very severe situation or condition. They wanted them to come and see us instead of going to the hospital, so that as you know, JPS right now has quite a few COVID cases, and they didn't want people that have a musculoskeletal condition like back pain or arm pain or neck pain to be exposed to that. So they allowed all the chiropractors in Texas to see the just the acute patients. But since my practice is a boutique practice and it's comprised mostly of wellness patients, now I will be able to see you all, and I wanted to tell you again how much I miss each and every one of you. So just to make it short and sweet, wanted to let you know that I'm going to be following CDC and OSHA guidelines, because number one, the safety is the name of the game, and we want to keep each and every one of you safe from me and me from you. And so for that reason, when you arrive, remember to text me from your car. Those of you that I had to see during this situation, which is very fluid and it changes so much with the COVID virus, to go ahead and text me when you arrive or call me from your car before you enter the building. I would like to request that you wear a mask or some kind of a face covering. It doesn't have to be a surgical mask or an N95, but wear a mask, and do not wear gloves, because unless those gloves are fresh and you put them on right there in the hallway, don't wear gloves, because the gloves can actually be a contaminant. So just a mask. I will have some sanitizer on hand for you, and then if not, it doesn't matter, because the way I'm scheduling everything is I'm going to sanitize the room and everything between patients, as I normally do, but now even more so. So for that reason, when you see me, I'm going to be wearing a mask, and then I will be wearing my regular glasses that I wear, and probably goggles. I usually have been wearing goggles, and also I haven't decided if I'm going to wear my PPE outfit or not. But for all those reasons, to make things a little bit more, I guess, to be a little more resourceful, I am limiting the days I practice due to the lack of or the high demand for the masks and for PPEs and for gloves, and also the cost of those things. I normally wear gloves anyway, but now they've kind of gotten a little more expensive. So you're going to be entering through the north end of the building for now, unless when you text me or call me, and then depending on the day of the week and when the other doctor returns that I share the office with, he probably won't return till June sometime. But up until then, I'll instruct you as to which door to come in through, or which door I will allow you in through. When you call to make your appointment, also, I'm going to be asking you some questions, like, and here are some of the questions. Have you traveled in the last 2 weeks, or have you spent any time, or you have been tested positive for the COVID-19? Have you or anyone that you have spent time with, have they had a fever or a cough? And then have you or anyone you have spent time with, have you had loss of taste or smell? Because that's another symptom of the virus. And then, of course, the high-risk indicators are for those of you that have hypertension, that you have an immunocompromised immune system, and anyone that's undergoing chemotherapy, which I don't have any patients of that type right now. And then, so if you have asthma or a respiratory issue, and if you're over the age of 60, those of you that are wellness patients, I know your medical histories pretty well by heart. But I will be asking questions of those that are newer to coming in to see me, and I will be asking those things. I'm going to ask you to come to the office by yourself. If you have someone, a family member with you, ask them to stay in the car, or drop you off and then come and pick you up because of safety issues. We're not allowing anyone, as far as the office, we don't even have a waiting room anymore. So all of the things we had in the waiting room, the magazines, everything has been removed because of the social distancing. Now, one more thing is I like to socialize a lot, but this time you're going to notice that I'm not talking a whole lot. I will talk when we get done with our precise adjustment or whatever our treatment protocol is. You'll see that I'm basically focused on that as usual, but I'm not going to be socializing with you that much because of the time, and because I have to sanitize the tables and everything, the doors between patients. Okay. I do enjoy speaking with each and every one of you, and but because of that, because of what's going on right now, it's probably not a good idea. And then of course we'll do the transactions of any kind of payment or anything in the office as usual. None of that's going to change. So just wanted to let you know that you know, if you need to see me or anything like that, you can call me if I don't call you, and then I will make safety the number one priority. Your number one priority for me and for you is to get you well, and then to keep you well. And I appreciate you all for your patience during this time, and don't hesitate to call me. And as I've always said, call me if you need me. All right, well, take care, and we'll talk later. All right, hope to see you all soon. Bye-bye.